Today we're going over coaching and progressing the clamshell exercise. So EMG for the glute muscles, glute medius, glute max, right? Sometimes you can't progress it very much. It gets a bad rap for being an exercise. It gets over-prescribed, right? Here's the thing, I actually really like the clamshell exercise. I think it's going to be phenomenal for athletes who need to get back to some sort of rotation eventually. Exercises like a sideline hip abduction have really high EMG for the glute medius, right? As opposed to the clamshell does not. The problem is that straight plane abduction is not the same as getting back to eventually throwing a baseball. So I think this is a good introductory exercise to start with. And the other piece is that this can be advanced really easily over the course of time. So I'm going to coach you how to do it, right? And then we're going to go through the harder advancements, right? So first, a little bit coaching. First thing you want to look for is having the shoulders stacked on top of one another, just like this, right? We're also going to have the hips stacked on top of one another, just like this. The knees are going to be bent, the hips are going to be bent. Keep in mind if you're trying to target some of the hip rotators like the piriformis, once you go above 60 degrees, you're no longer targeting the piriformis because it turns into a hip internal rotator, all right? So if you're trying to do that, you want to make sure that you're below 60. But here's about good, just like this. And from here you have your patient keep the heels together. And I want you to bring your knee up to the ceiling like you're trying to touch my hand. Very good. The other cue I like a lot is to pretend like you have a wall behind you, and certainly can do this with the wall behind you, just to make sure you're not rotating this hip back. So show me a bad rep, show me that hip coming back. So we don't want this, right? I want to make sure that the hip stays lined up with the other hip, stacked up, and comes right up in my hand just like this, right? If people go too far, oftentimes they'll start coming back towards me, so don't worry about that, all right? Just a short range of motion. You want to feel it right in the butt here. If you have an athlete who's not able to really recruit that muscle, maybe they had a femoral acetabular impingement surgery and having a hard time recruiting that butt muscle, just say, I want you to feel it right here. Focus your concentration on this, right? So this is a super easy exercise. Let's go over some progressions next. The next one is just taking a band, throw this around your knees, right? And we'll go through a few repetitions with this. What's nice about the clamshell is that if you want to use more resistance with a band, all you need is a harder band, right? So start with an easy band and work your way up. So same technique applies. Keep those hips stacked on top of one another. Keep those heels together. Hand right here, good, right back down. Let's do about 3 to 5 reps. Good, good. Where are you feeling this?
Right here.
Nice, and that's exactly what you want, all right? Let's take this band off. The next way I like to advance the clamshell is by adding a side bridge, okay? We use what's called a half side bridge. So basically your weight is going to be borne on your elbow, and it's going to be borne on your shin. So I want to make sure your weight is evenly distributed across your entire shin like this, and then make sure you got your weight evenly distributed across the entire forearm, just like that. Very good. So from here, you want to make sure the hips are stacked on top of each other, which they are. Shoulders are stacked on top of one another. I'm comfortable with this hip angle right here. Keep those heels together and bring this knee up into my hand. Yep, let's go ahead, 3 to 5 of these. Good. Now where are you feeling this? Good, take a breather. Exactly, so take a breather for a second. So what's really neat about this variation is now it's not just a top side hip that's working, the bottom side hip is firing isometrically, stabilizing, right? So most folks are feeling most of the work in that bottom side hip, okay? If you want to make this even harder, all we have to do is throw that band back on. You have that handy? Yeah. Good. Let's crank out a few reps with this guy. Good, pop back up again. Good. Hip stacked. Good, just 5 reps like this. And what you'll start to notice, this is freaking hard, right? So Chris doesn't have any hip pain, do you? Right? So he has no orthopedic injuries. And would you say this is challenging?
Yes.
Yeah, so it's pretty challenging in general. Most folks may not ever need to go beyond this stage right here, okay? But we will, just because we're probably dealing with some strong people who need to be advanced. Let's take this band off. This next variation right here, we call a super clamshell. I stole this directly from Dave Tilley, right, from Shift Movement Science. Let's go into that same side bridge position. We're going to do a clamshell, but at the top, I want you to separate your heels and reach this knee up to the ceiling, okay? So go ahead all the way back down again. Hip all the way down to the floor. Yep, and come all the way back up. Good, reach up to the ceiling with your knee, just like that. Good, and all the way back down again. The next piece I want you to do is as you come up, extend your hip forward. Okay, so your hips start bent, yep, and you fully extend. Let's go 5 of these. So what's really nice about the super clamshell is that not only are we getting hip rotation with the clamshell, we're also getting horizontal abduction on the bottom side hip, so we're controlling frontal plane motion, right? And we're also extending the hip too. So a lot of different motions are all combined there. How tough would you say that is right there?
Pretty challenging.
It's pretty dang challenging, right? So I can maybe do like 12, you know, when I'm fresh, just because it's a pretty challenging exercise. So for most folks, again, you don't have to go much further, but we will because we're crazy. Let's take this, we'll put it underneath your shin. And what this does is just extends the range of motion, all right? So now Chris's bottom side hip is sitting in relative hip adduction. So go ahead, a couple more reps of the super clamshell, right? Which makes things even more challenging at the very bottom. Okay? If you want to be really mean to your patients, you can add an ankle weight and just throw this on the knee. But like I said, you've got a lot of really good variations, and once you're doing these right here, you're probably ready to go to more sport-specific exercises like cable chops, med ball throws, all that stuff. So, all right, make sense? Guys, learning is not over. Click on this link right here to learn more. All right, thank you.